Okay, so I have my orders here for my patient. So we're giving him blood for his GI bleed today. I'm gonna go over the adverse reactions with him. I have noted he's signed consent. We do have doctor's orders for his blood, so we're gonna go in and give him some education. We're gonna hand hygiene, we're gonna provide privacy. Hello Darius, my name is Adriana. I'm gonna be your nurse today. Can you give me your name and date of birth? Okay, awesome. So today we're gonna be giving you a blood transfusion due to your GI bleed. So some adverse reactions we can have with your blood transfusion. You can just have some fever, some chills, some itchy, and shortness of breath. If you have any of this, I want you to let me know. But I will be in here while we are doing your blood transfusion just to make sure that everything's okay. I do have noted here that you have signed consent, date and time, which is awesome. And I would give you medications 30 minutes before your transfusion, but we don't have anything to do that, so that's good. I'm gonna raise your bed so I can take your vitals and just listen to your lung sounds real quick. I'm gonna raise the head of your bed up as well, just so I can not your feet. That's fine. Okay. Okay, I'm gonna take your blood pressure, take your pulse, take your temperature, respirations, oxygen. Everything looks good. Everything's within our limits is what we want. So now I'm gonna assess for our fluid overload. So I'm gonna note our jugular vein extension. Don't notice any, which is great. We're gonna check for, we're gonna check for edema. We're good there. Then we're also gonna assess our IV site real quick. Everything looks great, no redness, no signs of infiltration, which is awesome. Now we're gonna listen to our lung sounds really quick. Just take some deep breaths for me. Down here. Okay, those sound great. Now I'm gonna have you sit up for me so we can listen to the back of you. Just take some nice deep breaths. Okay. All right. Lay you back down. Okay, your lung sounds sound awesome. I don't know any abnormal sounds there. Okay. So we did all that. Now I'm going to go get my blood. Okay. So I'm coming over to my blood bank with my orders. So here we have our Darius Hassan. And then we're gonna, his birthday is 08/10/2000.
08/10/2000.
And his number is 98254137.
09254137.
And then my patient's blood is O negative, and we're gonna be giving him O negative blood. And then we have our expiration date, which is 3/28/26.
3/28/26.
Okay, awesome. Everything matches. And as I get my blood, I'm gonna check for any color, bubbles, chunks. Everything looks good. So we are good there. Okay. Now I'm going to put my gloves on, and we are going to get the saline hooked up and get everything all ready there. If I can get these on pretty fast. I did hand hygiene also. Okay. So we're first going to get this open. Okay. And we are going to peel everything off. Okay. To open it all up, we're going to close all of our clamps first. Okay. I don't know if we need to close that one, but we'll close it anyways. No, we don't need to. Close these ones. Oh boy. There we go. Okay. We're going to get normal saline hooked up first. Real quick. I'm going to toss this in the garbage. Okay. We're gonna use him as our table really fast, because why not? So we're first gonna spike our saline bag. Everything's clamped. So we're gonna hang this up first. Oh boy. Oh, we're tangled over. Okay. Then we need to flush my IV site, is what we need to do. So we're going to scrub our cap for 30 seconds. Make sure we get that all nice and clean. Okay, that's been 30 seconds. Now we're going to flush. Make sure we get all of our bubbles out. Oh, maybe a little too much bubbles. Okay, we're going to unclamp that. We're just gonna flush about that much. Okay, we're gonna clamp it back. Okay, we have flushed it. Now we're gonna hook this thing up to it. Oh. Then we would scrub this again for 30 seconds, but we don't have that. Okay, we're all hooked up there. We're gonna unclamp this one. Okay, that's all done there. So now we're gonna prime our tubing. So we first need to, I would prime the tubing before I hooked it up to his IV. We would do that, obviously, but we're not gonna take that off right now. Okay, so we're first gonna fill up our freaking filter. Above the line, maybe. We're almost there. Okay, and then we would prime this over the trash can, not inside his IV, because you could give him bubbles, and we don't want to be doing that. Fine though. Okay, I believe. Maybe I'm going crazy. Okay, yeah. Okay, now we're gonna clamp everything again. Okay. Now we're gonna start his blood, but we want to start the blood 30 minutes prior to getting out of the bank. Because yeah, that's just what we want to do. Okay, so we closed everything. Now we're gonna spike our blood bag, make sure that's clamped. Okay, we're gonna hang it up somewhere. Okay, now we're gonna start our transfusion, and we're gonna do 2 mLs a minute for the first 15 minutes just to monitor him for any reactions or anything. Yeah. So we're gonna open this. And this. Okay. So we got that going. Now it's gonna run through our line. Just make sure that everything's good as it goes. Okay. So as that's going, like I said, for the first 15 minutes, we're just going to monitor him for any reactions or anything for the first 15 minutes. It's just 2 mLs an hour. So after the 15 minutes, we are going to reassess his vital signs. And then after that, we're going to, so we do all his vital signs, make sure they're all good there. And then we're going to do the blood transfusion to what the doctor ordered, so just up to his mLs an hour. And then you want to infuse the blood within 4 hours. And if we do have a adverse reaction, we're going to stop the transfusion completely, rehook up all new saline and new tubing, and then we're going to notify our doctor and the blood bank, and then we're going to send the blood and all of the tubing to the blood bank for them to test it. So once our transfusion is complete, we are going to unhook everything, obviously, and give him new saline. And we are going to put the tubing into our red hazard bag over there, and then we are going to educate him on any like post adverse reactions, and what to do if those do happen, and then we are going to document everything.